Welcome to 5-Minute Fundamentals. This short lecture provides an overview of key concepts from Pearson's medical language, Immerse Yourself, by Susan M. Turley. Please note, this is a brief summary. It's not a replacement for the full review. For deeper understanding, examples, and practice, be sure to read the textbook and explore the complete resources available on Pearson's MyLab. Now, let's scrub into today's 5-minute focus. Let's take a closer look, literally, at how we image the human body and different challenges involved depending on what we're trying to see. First, imaging bones is relatively straightforward. Bones are dense and absorb X-ray well, which makes them appear white on a standard radiograph. But when we try to image soft tissues like muscles, organs, or the brain, it gets trickier. These tissues absorb fewer X-rays and don't contrast well, so we need advanced techniques like MRI or ultrasound to see them clearly. Imaging metabolic activity, what the body is doing and not just how it looks, is even more challenging. We often need nuclear medicine techniques like PET scans, which detect radiation emitted from tracers injected into the body to measure cellular activity. So in short, bones are easy, soft tissues require more finesse, and metabolic imaging is the most complex. Some imaging terms come from fascinating linguistic and scientific origins. For example, röntgenography is an older term for X-ray imaging, named after William Röntgen, the German physicist who discovered X-rays. Though we simply say X-ray, this reminds us how foundational his work was. To interpret images, we also need to recall body planes such as sagittal, coronal, and transverse. It's important for understanding how a body was sliced or positioned in a scan. Some other key terms would be oblique, used when a scan is taken at an angle, and decubitus, meaning laying down. Examples of some common forms of X-ray include mammography, fluoroscopy, computed tomography, angiography, and bone densitometry. Examples of common ultrasonography include 2D, 3D, and 4D, plus Doppler, color flow duplex, and echocardiography. When we move into nuclear medicine and imaging with tracers, things get even more interesting linguistically. Many of the elements that are used are radioactive isotopes with names rooted in Latin or Greek, such as gallium, indium, krypton, technetium, thallium, and xenon. Examples of common nuclear medicine exams include the myocardial perfusion scan, MUGA, PET scan, DAT scan, bone scan, radioiodine scan, thyroid uptake and scan, renal scan, ventilation perfusion, a HIDA, and a gastric emptying scan. So whether we're imaging bones, visualizing soft tissues, or tracking cellular metabolism, medical imaging is a powerful blend of physics, anatomy, language, and history. By understanding the roots of its terminology, we not only enhance our comprehension, but also gain a richer appreciation for the science and stories behind how we see the human body.